What I am about to share is going to change the way you look at every single blood pressure pill sitting in your medicine cabinet right now. If you are taking amlodipine, losartan, or lisinopril, there is a very real chance that one or more symptoms you have been dismissing as aging, stress, poor sleep, or just a difficult week is actually your body trying to tell you something specific about how your medication is affecting you. Something that nobody fully explained when the prescription was written. And here is what troubles me most about this. People do not usually get into serious trouble with these medications because they were prescribed incorrectly. They get into trouble because they do not fully understand what the medication is doing inside them. So they miss the signals until something serious happens. The tragedy is that these signals are often present for weeks, months, and sometimes even years before a major problem develops. The body whispers long before it screams, but many people never realize they should have been listening. Let me ask you something. Have you ever stood up from a chair and felt unexpectedly dizzy for a few seconds? Have your ankles become swollen by the end of the day, even though you have not changed your routine? Have you found yourself unusually tired despite getting enough sleep? Have you developed a nagging cough that simply refuses to go away? Or perhaps you have experienced moments where something just felt different, but you could not quite put your finger on it. If any of that sounds familiar, then this conversation may be one of the most important health discussions you hear this year, because these experiences are far more common than most people realize, especially after the age of 65. My name is Dr. Natalia Wright, and welcome to Dr. Natalia Wright, Senior Health. My mission is to help older adults understand their health in a way that is clear, practical, and empowering. I believe that every person deserves to understand what is happening inside their body, especially when it comes to medications they take every single day. Knowledge is not just power when it comes to health. Knowledge is protection. Think for a moment about how much trust we place in a small tablet. Every morning, millions of people wake up, pour a glass of water, and swallow medication without giving it much thought. That tiny pill becomes part of a daily routine, almost as ordinary as brushing your teeth. Yet behind that routine is a powerful chemical process influencing your blood vessels, your kidneys, your heart, your circulation, and sometimes even your energy levels and mood. The medication may be helping you tremendously, but understanding how it works can make the difference between simply taking it and truly managing your health. One of the biggest misconceptions I see among older adults is the belief that symptoms appearing later in life must automatically be caused by aging. It is easy to understand why. Aging changes many things. Energy levels shift. Balance may not feel quite as steady as it once did. Recovery from illness can take longer. Sleep patterns evolve. Because of this, many people assume every new symptom is simply another chapter in getting older. But what if that assumption is not always correct? I remember speaking with a gentleman in his early 70s who told me he had stopped taking his daily walks. For nearly a year, he believed he was slowing down because of age. He felt tired, his legs felt heavy, and he noticed swelling around his ankles every evening. He assumed it was just part of growing older. His family assumed the same thing. Yet after a careful review of his medications and a discussion with his physician, it became clear that his symptoms were strongly connected to the dose of a medication he had been taking for blood pressure control. Once adjustments were made, his energy improved significantly, the swelling decreased, and he returned to his daily walks. What struck him most was not that the medication had side effects. Every medication can have side effects. What surprised him was that he had never considered the possibility. For months, he had been blaming himself and his age for something that deserved a conversation with his doctor. That story is not unusual. Every week, countless older adults experience symptoms that they quietly tolerate because they believe they have no choice. They adapt, they compensate, they change their activities, they stop gardening, they stop walking, they avoid stairs, they take more naps, They gradually shrink their lives around symptoms that may actually deserve attention. This is why today's discussion matters so much. The medications we are talking about, amlodipine, losartan, and lisinopril, are among the most commonly prescribed blood pressure medications in the world. They have helped millions of people reduce the risk of stroke, heart attack, heart failure, and kidney disease. They are effective medications with an excellent track record when used appropriately. That is an important point to emphasize. The goal of this discussion is not to create fear. It is not to encourage anyone to stop taking medication. In fact, stopping blood pressure medication suddenly without medical guidance can be dangerous. The goal is awareness. The goal is understanding. The goal is helping you recognize the difference between a normal adjustment period, a manageable side effect, and a symptom that deserves medical attention. As we grow older, our bodies become more sensitive to medications. This is not because something is wrong. It is simply biology. The liver, which processes many medications, often becomes less efficient with age. The kidneys, which filter waste products and help remove medications from the body, gradually lose some filtering capacity over the decades. Body composition changes as well. Muscle mass often decreases while body fat distribution shifts. These changes influence how medications move through the bloodstream and how long they remain active. Imagine two people taking exactly the same dose of the same medication. One person is 45 years old. The other is 75. Even though they swallow identical tablets, the medication may behave differently inside their bodies. What feels mild for one person may feel much stronger for the other. This is why medication management becomes increasingly important as we age. There is another issue that often goes unnoticed. Many older adults take several medications simultaneously. Blood pressure medications may be combined with cholesterol medications, diabetes medications, arthritis treatments, acid reflux medications, sleep aids, or supplements. Each additional medication adds another layer of complexity. Sometimes medications interact. Sometimes illnesses temporarily change how medications behave. Sometimes dehydration creates entirely new risks. The challenge is that these changes rarely announce themselves dramatically at first. Instead, they arrive quietly. A little more fatigue than usual, a little more dizziness than normal, a little less balance, a little more swelling, a little more weakness, a little less stamina. Because these changes happen gradually, they are easy to overlook. Yet they often represent valuable clues. Let's begin with amlodipine, because it illustrates this concept perfectly. Amlodipine belongs to a group of medications called calcium channel blockers. Its primary job is straightforward. It helps relax and widen blood vessels, allowing blood to flow more easily through the circulatory system. When blood vessels relax, blood pressure decreases because the heart does not have to push as hard against resistance. From a cardiovascular perspective, this can be extremely beneficial. Many patients experience excellent blood pressure control with amlodipine. For some, it becomes a cornerstone of long-term treatment. Yet the same mechanism that makes the medication effective can also create some challenges. Picture a garden hose. When you widen the hose, water flows more freely. Blood vessels behave in a somewhat similar way. As vessels relax and widen, fluid dynamics throughout the body change. One of the most common side effects associated with amlodipine is swelling in the lower legs, ankles, and feet. At first glance, this may not seem particularly concerning. Some people notice their socks leave deeper marks. Others find their shoes fit more tightly by evening. Some observe puffiness around the ankles after standing for extended periods. The problem is not simply the swelling itself. The problem is what people assume the swelling means. Many older adults immediately worry about circulation problems. Others fear heart failure. Some become convinced they have developed a serious vascular condition. Family members often become concerned as well. In reality, the swelling may be related to the medication's effect on blood vessel dynamics rather than a new disease process. This distinction matters because it changes how the issue should be addressed. I once spoke with a woman who became increasingly concerned about swelling around her ankles. She loved spending time with her grandchildren, but by evening, her legs felt heavy and uncomfortable. She assumed she was developing a circulation disorder. The swelling became so frustrating that she nearly stopped participating in family outings. After a medication review, her healthcare provider recognized that the timing of her symptoms closely matched an increase in her amlodipine dosage. Adjustments were discussed, and the situation improved. The lesson was not that amlodipine was a bad medication. The lesson was that understanding the source of a symptom can completely change the conversation. Unfortunately, many people never have that conversation. Instead, they simply adapt to symptoms they believe are unavoidable. Another important consideration involves falls. Falls are not a minor issue in older adulthood. They represent one of the leading causes of serious injury among seniors. A broken hip, head injury, or major fracture can dramatically alter independence and quality of life. Blood pressure medications can sometimes contribute to fall risk, particularly when blood pressure drops too much or drops quickly when standing. Have you ever stood up and felt the room spin briefly? Have you ever needed a moment to steady yourself before walking? Have you ever grabbed a countertop or chair because you felt unexpectedly lightheaded? Many people dismiss these experiences because they last only seconds. Yet those few seconds can be incredibly important. A moment of dizziness while standing near a staircase, stepping into a shower, or walking across a parking lot can have serious consequences. This is one reason healthcare providers often recommend checking blood pressure in different positions, including sitting and standing, especially for older adults experiencing symptoms. The goal is not merely achieving a lower blood pressure number. The goal is achieving safe blood pressure control while maintaining balance, energy, mobility, and quality of life. That distinction is critical. Health is not just about numbers on a chart. It is about how you feel, how you function, and how confidently you move through your day. Many older adults spend years focusing exclusively on blood pressure readings while ignoring what their body is trying to communicate. Yet the most effective care happens when both pieces of information are considered together. A blood pressure monitor provides valuable data. Your daily experiences provide equally valuable data. When those two sources of information are combined, healthcare decisions become much more personalized and effective. And that brings us to another medication that deserves careful attention, particularly among older adults, losartan. While it works very differently from amlodipine, the lessons about awareness, monitoring, and recognizing subtle symptoms become even more important. Losartan belongs to a class of medications known as angiotensin receptor blockers, often abbreviated as ARBs. While the name sounds highly technical, the basic concept is surprisingly simple. Your body has a sophisticated hormonal system designed to regulate blood pressure, fluid balance, and circulation. One of the key players in that system is a hormone that tells blood vessels to tighten and signals the body to hold onto salt and water. Losartan works by blocking that signal. As a result, blood vessels remain more relaxed, blood pressure decreases, and the heart does not have to work as hard to circulate blood throughout the body. For many older adults, losartan is an excellent medication. It is often prescribed not only for blood pressure control, but also to help protect the kidneys, especially in people with diabetes. Many patients take it for years without significant problems. Yet even when a medication is working exactly as intended, understanding its potential effects can make a tremendous difference in long-term safety. One of the most important concepts to understand about losartan is that it influences how the kidneys handle potassium. Potassium is an essential mineral that plays a vital role in muscle function, nerve signaling, and most importantly, heart rhythm. Every heartbeat depends on a carefully balanced electrical system. potassium is one of the key elements that helps maintain that balance. When potassium levels remain within a healthy range, the heart functions smoothly. But when potassium levels become too high, the heart's electrical activity can become disrupted. This is where awareness becomes crucial, particularly for adults over the age of 65. Imagine for a moment that your body is like a finely tuned orchestra. Every instrument must play in harmony. Potassium is one of the musicians responsible for maintaining rhythm. If that musician suddenly starts playing too loudly, the entire performance can become unstable. The same principle applies to the heart. The challenge is that elevated potassium often develops quietly. It does not usually arrive with dramatic symptoms. Instead, it may begin with vague sensations that seem harmless. You might feel more tired than usual. You may notice mild muscle weakness. Perhaps climbing stairs feels slightly more difficult. Maybe your legs feel unusually heavy during a walk that would normally feel easy. The problem is that every one of those symptoms can easily be blamed on something else. People blame poor sleep. They blame stress. They blame aging. They blame the weather. They blame being busy. Rarely do they think, could this be related to my medication or my potassium level? That question alone can sometimes prevent serious complications. I remember hearing about a retired school teacher who prided herself on maintaining a healthy lifestyle. She exercised regularly, ate plenty of fruits and vegetables, and followed what she believed was an ideal heart-healthy diet. Her physician had prescribed losartan, and her blood pressure readings were excellent. Over time, however, she began experiencing increasing fatigue and muscle weakness. Because she was trying to improve her health, she actually increased her intake of foods rich in potassium, including bananas, tomatoes, potatoes, and orange juice. She assumed she was helping herself. What she did not realize was that her kidneys were not filtering potassium as efficiently as they once had, and her medication was contributing to potassium retention. When routine blood tests were finally performed, her potassium level was significantly elevated. Fortunately, the issue was identified before a serious cardiac event occurred. Stories like this remind us of an important reality. Sometimes doing the right thing for one aspect of health can unintentionally create challenges elsewhere. That does not mean healthy foods are bad. It means health decisions should always be viewed within the context of the whole person, including age, kidney function, medications, and medical history. This is why routine laboratory monitoring is so valuable. Many people view blood tests as an inconvenience. They see them as another appointment, another needle stick, another task on an already busy schedule. But blood tests often reveal problems long before symptoms become obvious. Think of them as an early warning system. By the time symptoms become severe, a problem may already be advanced. Laboratory testing